If you're walking every day and still feeling tired, stiff, or like your health just isn't improving, I need you to stop and watch this. Because here's the truth. Most doctors don't take the time to tell you. Walking is one of the most powerful medicines we have for your heart, your joints, and your brain after 50. But only if you're doing it right. And most people, they're not. In fact, there are 7 specific mistakes that turn a healthy walk into something that's quietly working against you, damaging your joints, straining your heart, and leaving your body more inflamed than when you started. I've seen it in my own patients for over 2 decades. Good intentions, wrong execution, and real consequences. Let's fix that, starting right now. My name is Dr. Nathan Cardwell, and I'm a cardiovascular surgeon. I've spent more than 20 years operating on hearts, and I can tell you with absolute certainty that what happens before you ever need surgery matters far more than anything I can do in an operating room. Walking is one of those things. Done right, it lowers your blood pressure, strengthens your heart muscle, reduces arterial stiffness, and can add years, genuinely good years, to your life. Studies out of Harvard and the American Heart Association have shown that just 30 minutes of proper walking most days can cut your risk of heart disease by up to 35%. But that word proper, that's doing a lot of work in that sentence. Because the version of walking most people over 50 are doing, it's missing critical pieces. And some of those missing pieces are actually creating new problems: knee damage, poor circulation, dangerous blood pressure spikes, even increased fall risk. In the next few minutes, I'm going to walk you through all 7 mistakes, one by one, in plain language. No medical jargon, no confusion, just exactly what's going wrong and precisely how to fix it. By the end of this video, your daily walk will work completely differently for you. Before we dive in, if you're new here, this channel is dedicated to giving you real, honest medical information that actually helps you live better after 50. No fluff, no scare tactics. Just straight talk from a doctor who genuinely cares. Hit that subscribe button and the notification bell, because I post new videos every week, and some of them could genuinely change how you manage your health. Now, one important note before we go further. Medical disclaimer. The information in this video is intended for educational purposes only and does not constitute personal medical advice. Every body is different, and what works for one person may not be right for another. If you have existing heart conditions, joint problems, diabetes, or any chronic illness, please talk to your own doctor before making changes to your exercise routine. All right, 7 mistakes. Let's get into it. Mistake number 1, walking without warming up your joints. First, let's start with the one that almost everybody skips. Most people wake up, lace up their shoes, walk out the door, and immediately start moving at full pace. And I completely understand why. You're busy, you want to get it done, and a warm-up feels like wasted time. But here's what's actually happening inside your body when you do that. Your joints, especially your knees, hips, and ankles, are lubricated by something called synovial fluid. Think of it like the oil in your car engine. When you've been sitting or sleeping, that fluid thickens up and pulls back from the joint surfaces. If you start walking hard before that fluid has a chance to warm up and spread back through the joint, you're essentially running a dry engine. Over time, that creates real cartilage wear. And after 50, your cartilage doesn't bounce back the way it used to. Here's exactly what to do instead. Before you take a single walking step, spend just 3 to 5 minutes doing gentle joint circles, ankles, knees, hips, right there in your driveway or living room. Then start your walk at about half your normal pace for the first 3 minutes. Let the fluid warm up, let the muscles lengthen, then pick up your pace. What most people get wrong is thinking the warm-up is for muscles. It's actually your joints that need it most. Mistake number 2, walking with your head down. This one sounds almost too simple to matter, but I promise you, it matters enormously. When you walk with your chin tucked down, looking at the ground or at your phone, your entire spine shifts forward, your neck juts out, your upper back rounds. And that position, called forward head posture, puts enormous compression on the cervical spine and actually restricts how fully your lungs can expand with each breath. Less lung expansion means less oxygen delivered to your muscles and your heart with every single step. You're essentially walking with one hand tied behind your back, breathing-wise. And there's a cardiovascular piece here too. Compressed posture raises perceived exertion, meaning your heart is working harder than it needs to for the same amount of effort. Over a 30-minute walk, that adds up. Here's exactly what to do instead. Imagine there's a string attached to the very top of your head, gently pulling you upward. Chin parallel to the ground, shoulders relaxed and slightly back, not tensed up around your ears. Eyes looking about 10 to 15 feet ahead of you on the path. That's it. That one adjustment opens your chest, aligns your spine, and immediately improves your breathing efficiency. What most people get wrong is fixing their posture for 30 seconds and then drifting right back down. Set a phone reminder to chime halfway through your walk as a posture reset. Mistake number 3. Keeping the same pace. Every single walk. This is a big one, and it's the mistake I see most often in my patients who walk faithfully every day but still aren't seeing improvements in their cardiovascular health. Here's the simple science. Your heart is a muscle, and like any muscle, it only gets stronger when you challenge it. If you walk at the exact same comfortable pace, day after day, your heart adapts very quickly, usually within 2 to 3 weeks, and stops getting stronger. You've hit what exercise physiologists call a plateau. Worse than that, walking at one steady, comfortable pace actually does very little for something called your cardiovascular variability, which is one of the strongest predictors of long-term heart health we measure as cardiologists. Here's exactly what to do instead. Try something called interval walking, and it's much simpler than it sounds. For every 5 minutes of your normal, comfortable pace, add just 60 seconds of brisk walking. Not running, just faster, enough that talking becomes slightly difficult. Then drop back to comfortable. Repeat that cycle throughout your walk. That simple switch, proven in research out of Japan and Denmark, improves blood sugar control, cardiovascular fitness, and even mood significantly more than steady pace walking alone. What most people get wrong is thinking they need a fitness tracker or a complicated program. You just need a watch and the willingness to push slightly harder for 1 minute at a time. Mid-video retention hook. Now, we're halfway through, and I need you to stay with me. Because the mistake I'm going to share with you at the end of this video, it's the one that genuinely shocked my patients the most when I explained it. It involves something almost every walker over 50 is doing immediately after their walk, and it's quietly undoing a significant portion of the cardiovascular benefit they just worked hard to earn. Don't go anywhere. Mistake 4. Wearing the wrong shoes, or old ones I know. You've heard wear good shoes before, but I want to be specific here because good shoes means something very particular after 50. And most people are still getting it wrong. As we age, the fat padding on the soles of our feet naturally thins out. At the same time, our arches tend to flatten, and our ankles lose some of their natural stability. This means the shoe that worked perfectly for you at 40 is genuinely not the right shoe for your foot at 60. Walking in worn-out shoes, or shoes designed for appearance rather than biomechanics, creates a chain reaction up your entire body. Improper foot strike leads to increased knee torque, hip misalignment, and lower back compression. I've had patients come to me with chronic lower back pain who fixed it almost entirely by changing their walking shoes. Here's exactly what to do instead. Go to a specialty running or walking store, not a general sports retailer, and ask for a gait analysis. It's usually free. They'll watch you walk and recommend a shoe matched to your specific arch type and foot strike pattern. Replace your walking shoes every 300 to 400 miles or every 6 to 8 months if you walk daily. And look specifically for shoes with a wide toe box, good arch support, and a slightly cushioned heel drop. What most people get wrong is waiting until their shoes look worn out on the outside. The internal cushioning and support breaks down long before the outside shows any visible damage. Mistake 5. Not drinking water. Before you walk, dehydration and walking are a dangerous combination, especially for your cardiovascular system and especially after 50. Here's why this hits harder as we age. Your body's thirst signal weakens significantly with age. By the time you actually feel thirsty after 50, you're already measurably dehydrated. And even mild dehydration, as little as 1 to 2% of body weight, causes your blood to thicken slightly, which forces your heart to work harder to pump it through your vessels. For someone with any degree of arterial stiffness, which is extremely common after 50, that extra cardiac workload during exercise is not trivial. It raises blood pressure unnecessarily and reduces the cardiovascular benefit you're trying to achieve. Here's exactly what to do instead. Drink 8 to 12 ounces of water, about 1 full glass, 20 to 30 minutes before your walk begins. Not during, not after, before. This gives your body time to absorb and distribute that fluid before your cardiovascular system needs it. Carry water for walks longer than 20 minutes and take small sips every 10 minutes. Don't wait until you're thirsty. What most people get wrong is drinking a large amount of water right before they walk, which causes discomfort and sloshing. Timing matters just as much as quantity. Mistake number 6, ignoring your arm. Swing. Your arms are not passengers on your walk. They're active participants, and when they're not moving correctly, you're leaving real benefit on the table. Proper arm swing does 2 things that most walkers don't realize. First, it counterbalances your leg movement, which reduces rotational stress on your lower spine with every step. Second, and this is the cardiovascular piece, engaged arm movement recruits your upper body muscles, which increases your overall caloric burn and cardiac output by up to 10 to 15% without any increase in perceived effort. Most people either let their arms hang loosely, swing them across their body, which actually increases spinal torque, or they walk with their hands in their pockets entirely. Here's exactly what to do instead. Bend your elbows to approximately 90 degrees. Keep your hands loosely closed, not clenched into fists. Swing your arms forward and back, not across your body. Your right arm should move forward as your left foot steps forward. Keep the movement controlled and deliberate, especially for the first few minutes until it becomes natural. What most people get wrong is overcorrecting and swinging their arms so aggressively it looks like speed walking. The movement should feel natural and relaxed, not performative. Mistake number 7, sitting down immediately after your walk. All right, here it is, the one I promised you. You finish your walk. You're warm, you're a little breathless, maybe your legs feel pleasantly tired, and the most natural thing in the world is to come inside, pour yourself a glass of water, and sit down in your favorite chair. And I completely understand that impulse, but here's what's happening inside your cardiovascular system in that moment, and why that chair is quietly stealing some of the most important benefits your walk just created. During your walk, your heart has been pumping hard. Your blood vessels, particularly in your legs, have dilated significantly to deliver oxygen to your working muscles. Your leg muscles themselves have been acting as what cardiologists call a secondary pump, squeezing blood back up toward your heart with every step. The moment you sit down abruptly, that secondary pump stops. Completely, but your blood vessels are still dilated, so blood pools in your lower extremities, your calves, your thighs, and the return flow back to your heart drops suddenly and significantly. For a healthy 30-year-old, the body compensates quickly. But after 50, especially if you have any degree of blood pressure, irregularity, venous insufficiency, or arterial stiffness, that sudden pooling can cause a sharp drop in blood pressure. It triggers what's called post-exercise hypotension. And in some cases, it can cause dizziness, lightheadedness, or in vulnerable patients, a cardiac event. But here's what makes this even more important than just safety. That 3 to 5 minute window immediately after your walk is when your body is primed to do something remarkable. Your blood vessels are open and responsive. Your insulin sensitivity is at its peak. Your muscles are actively hungry for nutrients. Exercise physiologists call this the metabolic window, and most people slam it shut the moment they sit down. I want to tell you about a patient of mine, a 68-year-old retired teacher named Margaret. She came to me frustrated. She'd been walking 40 minutes every morning for 2 years, and her blood pressure had barely budged. Her cholesterol numbers were still stubbornly high. She was doing everything right, she said, and she was. Almost everything. When I asked her what she did after her walk, she said, "I come in, sit down, and have my morning coffee." I asked her to try one thing, just one thing, for 4 weeks. Instead of sitting down after her walk, I asked her to spend 4 minutes doing a slow, gentle cool down, continuing to walk slowly around her kitchen, doing slow leg stretches, keeping her body upright and her legs moving just enough to let her cardiovascular system downshift gradually. 4 weeks later, her morning blood pressure readings had dropped by an average of 9 points systolic. She told me she also felt less stiff during the day and was sleeping better at night. 9 points. From a 4-minute cool down. Here's exactly what to do instead. When you finish your walk, do not stop moving abruptly. Spend the final 3 to 5 minutes gradually slowing your pace, from brisk to moderate to a gentle stroll. When you get home, don't sit immediately. Stand and do 4 to 5 slow, gentle stretches, a standing calf stretch, a gentle quad stretch, and a slow forward fold if your back allows it. Keep moving at low intensity for at least 3 to 4 minutes after your heart rate starts coming down. This gradual cool down allows your blood vessels to slowly return to their resting diameter. It keeps that secondary leg pump working long enough to prevent blood pooling. And it extends that metabolic window, keeping your body in its most responsive, beneficial state for longer. The specific dose? 3 to 5 minutes minimum of slow walking after your main walk ends. Then 3 to 4 minutes of gentle standing stretches. That's it. 8 minutes total that most people are simply throwing away. What most people get wrong is thinking the cool down is optional. A nice extra if you have time. It's not optional. It's the punctuation mark at the end of your walk that determines whether your body files that session as beneficial or stressful. So let's bring it all together. 7 mistakes, 7 fixes. And not one of them requires you to walk longer, work harder, or spend money on expensive equipment. Warm up your joints before you start. Lift your head and open your chest. Vary your pace with simple intervals. Wear shoes that actually match your foot. Hydrate before you go, not after. Engage your arms deliberately. And when you finish, please, don't sit down straight away. Give your heart the 5 minutes it deserves to come home safely. These aren't small tweaks. Done consistently, these changes can meaningfully reduce your blood pressure, protect your joints, improve your circulation, and make every single walk you take from this point forward work significantly harder for you, not against you. Your daily walk is one of the most powerful gifts you can give your body after 50. Let's make sure it's actually delivering everything it's capable of. If this video helped you, please hit the like button right now. It genuinely helps this information reach other people who need it. Share it with someone you walk with or someone you've been trying to get moving. And if you want to go deeper, I've put together a video on the 5 foods that are silently damaging your heart after 60. It's right there on your screen. I think you'll find it just as eye-opening as this one. I'll see you in the next one. Take care of that heart. Nobody else can do it for you.